Menopause has been shrouded in silence for far too long, and the consequences are costly. On World Menopause Day, it's time to shed light on this often ignored topic and recognize its impact on women's lives, society, and the economy. But here's where it gets controversial. While many advocate for change, the progress is slow and scattered. The hidden crisis. Every year, over 450 million women worldwide embark on the decade-long journey of perimenopause and menopause. Yet the support they need is lacking. Research by the World Economic Forum reveals a staggering potential. Addressing the women's health gap in menopause could save 2.4 million disability-adjusted life years and contribute $120 billion to annual GDP. These numbers translate to reduced absenteeism, stable household incomes, and less strain on healthcare systems. But more importantly, they represent women living with improved well-being and confidence. The missing piece. The issue is not a lack of awareness, but a lack of preparation and coordination. Diagnosis and care are often delayed, inconsistent, or inaccessible. A Yale University review found that while 60% of women with significant menopausal symptoms seek treatment, 75% remain untreated. This gap in care is partly due to inadequate training. Many family medicine doctors receive minimal education on menopause. The impact on the workforce is significant, with 1 in 4 women considering leaving work during this transition, and 1 in 10 quitting due to symptoms. It's not just about productivity. It's about lost opportunities, leadership gaps, and unnecessary family stress. From evidence to action. As an expert member of the World Economic Forum's Global Alliance for Women's Health and a medical advisor to Halle Berry's Respin Health, I witness the power of evidence-based advocacy. These organizations are translating research into actionable steps, influencing clinical standards, employer policies, and policy frameworks. When advocacy leads to tangible, replicable actions, it becomes impactful. Halle Berry's involvement as a public ambassador for the Global Alliance for Women's Health demonstrates the growing momentum to redefine menopause and empower women to take charge of their health. The call to action. We must normalize conversations about menopause and make guidance accessible, says Halle Berry. Menopause should be integrated into primary care, with screening starting in a woman's 40s and 50s. Evidence-based options include lifestyle changes, non-hormonal treatments, and informed hormonal therapies. Mental health and cardiometabolic risks should be addressed, as they often accompany menopause. Referral systems must connect various healthcare services to provide clear guidance. Workplaces have a pivotal role. Simple adjustments like flexible schedules, paid time off for symptom management, and practical amenities can significantly reduce absenteeism. Benefits should explicitly cover menopause, and manager training should promote support without compromising privacy. Research and product design must prioritize diversity and evidence-based solutions, ensuring accessibility and effectiveness. Policy as a catalyst. Menopause services should be included in national health packages and insurance coverage. Governments can incentivize employers to adopt menopause-supported policies through standards, recognition, and rewards. Public campaigns can replace stigma with practical knowledge. Simple indicators like time to diagnosis, treatment access, and workforce participation can drive accountability and progress. The ripple effect. Prioritizing women's health through menopause has far-reaching benefits. Early diagnosis and proper treatment reduce absenteeism, retain experienced talent, and prevent costly complications. These improvements accumulate across women and organizations, ultimately boosting national productivity. However, the most significant gain is the improved quality of life for women, marked by better sleep, clearer thinking, and restored confidence. Advocacy and action. Effective advocacy combines public leadership, technical expertise, and coordinated efforts. Public figures, researchers, and clinicians must work together to define and implement quality care standards. Cross-sector collaborations ensure that employers, healthcare systems, and governments align on practical timelines and standards. Platforms like the Global Alliance for Women's Health and the International Menopause Society facilitate this shift by bringing experts and leaders together. The way forward. Health systems can integrate brief screening and counseling into primary care visits, creating robust referral pathways. Medical education can enhance menopause training. Employers can establish menopause policies, train managers, and update benefits. Researchers can design diverse and comparable studies. Policymakers can include menopause care in basic benefit packages and demand transparent reporting. Culture change is key. Partners, friends, and community leaders can create a supportive environment by sharing experiences and information without judgment. World Menopause Day should be a yearly call to action, asking if we've made it easier for women to access information, care, and support. The path is clear. Now is the time for action to ensure a brighter, healthier future for women.